How is the NHS frontline staff been coping? They've had a lot of difficulties. At present, working people are rallying around calls to fight together against the calamity, and they cooperate a lot. The frontline NHS staff, in particular, are making enormous sacrifices to minimize the spread and save lives. Many to help, despite the risks involved in a poor health environment. Unfortunately, quite a few frontline medical staff have even died as a result of risking their lives to save others. They kept asking for masks and other measures to create a safe working environment, but supplies were not readily available. People have been saluting the spirit and contribution being made by the NHS workers. At the same time, they're angry at the chronic shortage of supplies and equipment. The UK has been crippled in its efforts to fight the corona crisis as a result of policy privatisation and dismantling of the NHS. Sir Simon Stephen, who is the Chief Executive Officer of the NHS, is accountable to Parliament for over £120 billion annual health service funding in charge of the NHS when he was made the Chief Executive. And he started further dismantling the NHS by giving powers to GPs to have a major influence on spending the NHS budget. Obviously, the GPs will pursue their private interests as well. A lot of GPs provide public service as well as have their own private surgeries, and their self-interest, in this case, will dominate. And private service providers also are able to enrich themselves, providing better care to patients with private cover. Some public hospitals face closures and services scaled down through urgent care centres, such as Ealing Hospital, Charing Cross, Hammersmith. All these in West London were facing threats of closures, and this led to deterioration in the provision of services. It's only a lot of agitation, anger by the community, protest at a local level, national level. All these helped to force the government to change the policy of closure of hospitals. But otherwise, that has led to a lot of deterioration in the facilities and services in that, adding to the current problem. The current inability of the British government to quickly respond to tackling the coronavirus crisis can be traced to all this, to the gradual destruction of the NHS, creating severe shortage of staff and necessary equipment, which would have been there had all this privatisation not taken place. Many lives could have been saved had the NHS not been dismantled through these policies by successive governments. The Labour Party brought the private funding initiative, then Cameron, such called better healthcare. The names were used, but all was actually dismantling of the NHS and privatising. People are demanding that supplies and much needed equipment be given a top priority in order to minimize the risk in the environment in which they're being forced to work. Resulting in this privatisation, and it's caused the UK government's response to be criticised by both the public and even many experts, with unfavourable comparison drawn with other similar countries that were able to handle the corona crisis much better and being much better prepared, and responding quicker, providing service and facilities on a much better scale. Why couldn't Britain done the same, especially when the NHS was the pride of this country? The ministers have been dogged by criticism that they failed to quickly ramp up testing capacity as late February and early March. They introduced the lockdown measures and social distancing too late. And the politicians leading Britain's response, including Johnson himself, appeared too slow to recognize the seriousness of the threat. Even now, there are numerous reports of frontline health workers not having adequate personal protective equipment, and there's been growing discontentment.